Hi, this is Dr. Ando, physical therapist, and Jenna, our wonderful dancer. And so we wanted to demo some core stabilization exercises. When Jenna first came in, she did have some back problems, and especially into her hip area through here, and also in the front part of her pelvis. And so we were able to, in a few treatments, straighten the pelvis out, and now we're working on the muscles for the correct length, and also for to decrease the pain that she might have in the hip. So when that happened, how did it affect your dance, Jenna?
Well, I didn't feel pain. I haven't felt the pain in a couple weeks. Now it's just tingling instead of painful, which is a great, really great for dancing.
Great. How's your balance doing?
Good. Yeah, it's working a lot.
And core strength's about, what, 90% of your expectations, or?
Yeah,
getting there?
It's getting there.
Okay.
I'm working on it.
All right, why don't you lay down, and let's look at some of those core exercises. Put your hand down on your back there. So the typical core stabilization process would be to have her go to brace, and then legs up into a 90-90 position, which is really easy for Jenna. In fact, she can probably get her legs out straighter, increase the lever arm, and still she's such in great shape that this is not very challenging for her. Is that correct? Well, she's thinking about that. Okay, now let's put your feet up on the roll here. Other exercises that we can do that you'd see typically is a bridge. So ahead and bridge up, which is easy for her to do. And then what you can do is get into a stepping position. So go ahead and step slowly and recruit the core so that you don't drop. She either shouldn't drop down or shouldn't rotate at the hips. And then if she were to get the legs out straighter, just get your heels on there, all the way out, and plank out, which is good. And then Jenna is such good shape that she can now start working on her core stabilization. And that's what, a little bit more challenging? Okay, good. And then if we were to get the, come on off of there, and let's put your feet and sandwich them like this, and grab them there, and then bridging. This position is also a little more challenging since the roll is a little bit more unstable. You have to work on that one. Okay? And then up and lifting, or both arms up in the air, just stabilizing like that is a little bit more difficult for her. Okay? All right, come on off of there. Other core exercises that we're having Jenna work on include some general strengthening onto the ball. So let's do a push-up there and let's show that. Not many females can do this as well as Jenna does. When you're looking at their back, she's not breaking through here, she's not folding, and she has such good upper body strength that she can actually do some pretty clean looking push-ups. This is the hardest push-up you can do, right, Jenna?
Come
on up there.
Yeah.
That looks really good. Okay, and then onto the ball with your feet up on the ball. And then you can do some bridges there also. And then bring the ball in and out. And to challenge that a little bit more, she can put her hands up in the air also. And as you can see, as we increase the difficulty, you want to make sure she's successful. So you put one finger on the floor and then try that again. Gets better. And put the other finger on the floor. And then back up again. And that's about the level of difficulty that you would best be learning.